Hello, everybody. This is Angie, and if you've had thermography done at Connor's Clinic, you will most likely speak to me about your report. So this is a preview of what you can expect when we go over your thermography results. So we'll talk about what thermography is, scheduling your thermography review. So you'll want to make sure that you do that after you have your thermography scan. It's a 15-minute appointment with me. I'll send you a Zoom link for the appointment. We'll go over that in just a minute. We'll talk about what's included on the report, what the radiologist, what they base their findings on, important information on the report. We'll look at a sample report, and then we'll also talk about next steps. So thermography captures and records temperature variations on the skin, which is the largest organ of the body. The surface of the skin provides vital information that is directly influenced by complex metabolic and vascular activity below the surface of the skin. These patterns of activity can vary in intensity and distribution over each area of the body, and that's represented by images with variation in colors. In looking at variations in skin temperature, we can see asymmetric, abnormal, or suspicious thermal patterns. These patterns may be recognized then by the interpreter as abnormal physiology or function, or they may not. These findings may be able to contribute then to the decision-making process regarding future therapy, maybe some additional testing that you might want to have done, and possibly an eventual diagnosis. Thermography itself is not a diagnostic tool, but it can give us hints about what may be going on. If you haven't already done so, you'll need to call the clinic to schedule your thermography review appointment. Again, this is about 15 minutes. Prior to your thermography review, you can look for an email from Connor's Clinic. I will send you the Zoom link inside of that email. So about 5 minutes before our appointment, while you're on your PC or Mac, you can click on the link in that email that I send you to join the web conference. So this is what the body of the email will look like. It'll list the time and date of our appointment that I scheduled, that you scheduled, and the link to click on. If you've not downloaded Zoom to your device prior to this appointment, I just ask you to click on this link about 5 minutes before our appointment. You may need to then download the app onto your computer, which you'll just follow through some prompts to download it onto your device, and then you'll be able to click to be able to join in on our meeting. And then you'll want to just make sure that your computer volume is turned up so that you can hear me and I can hear you. We won't see each other, but you will see my screen that shows your report. When you get your report, it'll have all of the information that you provided on your thermography intake form. It'll contain the radiologist's interpretation of the images and recommendations for next steps if they are recommending any. For breast scans, each woman will receive a grading or classification, identifying what level of risk you're currently at. The report also has an explanation of thermography, similar to what we just talked about, a color scale, and of course your thermography images. So what are the findings based on? They're based on your thermography intake information that you provided on the form, the Connor's Clinic thermography intake form. Your diagnosis is included on that, as well as the health history that you provide on that form, your clinical concerns, your family history, and of course, findings are based on the images. The radiologists that read these images do not have they're not privy to what we do here at Connors Clinic with our patients. They don't know about the findings with the exams or the therapies or protocols. So all they know is the thermography, intake information, and your images. When we take a look at a sample report in just a minute, you'll see information that is highlighted. This is my highlighting, and I like to go in and look just prior to our appointment. I will go in and look at your thermography report and your images, and I'll go through and I will highlight the things that I want to make sure that I point out to you. You'll want to make sure to read the rest of your report when we get done talking, and of course, if you have any questions about anything after that, don't hesitate to reach out to me. And again, you will receive a grading classification if you had a breast scan done. So let's take a look at the report. When we start our meeting, I will have images up on one side and your report up on the other side so that I can be going over your images while we look at your report. Health history that you provided is located here. The thermographic interpretation is here. And they typically start at the top of the body. So the first section is the head and neck section. And the first thing that they mention that I want to point out to patients when I see this is hyperthermia around the mouth. When we see this, unless a patient has just had dental work done or know that they've had some irritation to the gums or teeth, when we see this hyperthermia around the mouth, that is something we want to nip in the bud. You can see on the report here that the radiologist noted that this hyperthermia is most likely consistent with some degree of what might be subclinical dental periodontal irritation. Many patients are asymptomatic. They don't have any pain in their mouth or know of any infection. But this is one thing that we like about thermography is it can give us hints as to what's going on in the body. So we recommend when we see this, our tooth and gum oil. It comes in a dropper bottle. It's about 70% black cumin seed oil and 30% oregano oil. And it's a good preventive, a good antibacterial, will help fight infection. We don't want periodontal irritation, inflammation to turn into periodontal disease that can lead to other issues in the body with the heart, and it can lead to cancers as well. So that is common. We may find that on your report as well. On this person's report, there's also increased activity at the front of the neck, which the radiologist noted might be suggestive of some degree of thyroid dysfunction. Correlate clinically. So what that means is you might want to have that checked out. And you can have that checked out with your doctor with a blood test. They can do a thyroid workup and see how your numbers look there. You can also set up an appointment with us to chat about that. We may be able to do kinesiology to test and see if there is anything going on with the thyroid, or if that's coming up with kinesiology, we can help address that as well. On this person's report, there are no findings to indicate significant carotid artery dysfunction, but there is a slight increase at the base of the right carotid artery, which is this area here. That might be suggestive or be related to systemic inflammation or elevated CRP levels. CRP stands for C-reactive protein. That's an inflammatory marker. So this is not uncommon. In inflammation, systemic inflammation often leads to disease. So this is not uncommon to see with our patients that come in. And then in the breast section, this person does have some slight areas of thermic and hyperthermic activity to the central and peripheral regions of both breasts. So centrally located throughout this area here and to the sides, some slight hyperthermia here. And they do not appear suspicious, but should be monitored. Bilateral underarm hyperthermia, they can tell by the patterns that this is consistent with lymphatic congestion. For our patients that have come into the clinic with our full program, our full plan patients, you spent 2 days here, and we on day 2 went over your 3-ring binder and talked about some home exercises. One of those sheets talks about lymphatic exercises. So this is where I would probably refer patients to that sheet if we haven't already talked about it, just to revisit that. And I would suggest that the patient continues or starts to do one or more of those lymphatic exercises to help keep lymph moving. In the breast section, if it's a good scan, you'll see words like this, that the study is suitable to be archived and compared with a repeat study in 3 months. So the repeat study in 3 months gives us a comparison. So we have these first set of images, and in 3 months, when you come back for your follow-up scan or your baseline scan, they will compare the images from that scan to the original scan and be able to then give a recommendation as to whether or not you need to have, some further monitoring done on a more regular basis, or if things are changing, if they notice that patterns are changing, or if hyperthermia is increasing, or maybe there's some vascular patterns that indicate there may be some developing pathology, they'll be able to note that on the 3-month baseline scan. And if not, then, and if things look just like this and don't appear to be changing, then typically after that baseline scan, unless a woman feels any additional lumps or starts having any dimpling of the skin or some other symptoms, it's okay typically to wait and then have a test done, another scan done in about a year. One other thing that I notice a lot in the thermography reports is something like this. Indicates some degree of, or maybe indicative of, or verbiage like that. So they can't say specifically what these thermal patterns are. They can only say that this is what it looks like to us. It could be this, it could be that. And then again, they may recommend that you get it checked out further. Many times we see this as well. Hyperthermia consistent with myofascial inflammation, lymphatic congestion, and or muscular tension. That is very common to see on thermography reports. Myofascial inflammation refers to inflammation of the connective tissue. Connective tissue is weaved all throughout our bodies, from head to toe, and we see this quite a bit. Lymphatic congestion, again, just want to point to those lymphatic exercises again. And then muscular tension. We all carry some degree of muscular tension. So if we see a lot of that scattered throughout the report, I may suggest that the patient does some relaxation techniques, gets a massage, something to help relax. A hot tub, maybe soaking in some Epsom salt would be good. In the abdomen, they mention here that there is some hyperthermic activity around the belly button area, which may indicate some element of gastrointestinal autonomic neural activity, and they're suggesting a clinical evaluation, further investigation to find out what these patterns might be correlated with, to tie them together with any symptoms. And then on the report, there's always a discussion section which typically recaps some of the things that are important on the report, and then a follow-up. And all initial breast scans will say something like this, that follow-up breast imaging is recommended in 3 months to establish a baseline before continuing with annual comparative studies. And here is where the classification or the grade is listed. Each breast will have its own, and in this case, the grading is at low risk for both left and right breast. There's a classification key here so a patient can read more about their grade. As you scroll down your report, you'll see information about the procedure, protocols, what normal findings and abnormal findings consist of. So you can use this information when you're talking with us or with your other practitioners. Further testing may be suggested. And thermography is, especially with breast health, it's good to monitor over time. If desired, of course, you can set up an appointment with us to talk about anything that is found on your thermography imaging report that you might want to have checked out further. We can talk about that. We may be able to do some kinesiology testing to see if it comes up with kinesiology. And repeat full body scans are not typically done, but we do repeat breast scans. We can monitor breast health over time, but there are just too many things in the body that could change. And breast health is what we really want to monitor. We can, if you wanted to have a whole upper body and breast scan done to see if the hyperthermia around your mouth has decreased because you've been using the tooth and gum oil, if you want to just satisfy your curiosity that way, we certainly could, but it isn't necessary. So we do repeat breast scans only, typically. And then when we are done talking over our Zoom appointment, I will be sure to email your report to you so that you have a copy of it. So I thank you very much for listening, and I hope that this preview has been helpful for you, and I'm sure I will talk to you soon. Thank you.